Hi, welcome to New Start Now. I'm Don McIntosh, and we're glad you're with us today. We're going to be talking about the heart, and joining us is cardiologist Brian Schwartz. We're glad that you're with us, doctor.
Well, thank you very much, Don.
You and I were talking, and we need to cover what some of the bigger risk factors are for heart disease. And, how big a problem is heart disease, first off?
Well, heart disease and vascular disease are the #1 killers in the United States and quickly becoming the most common cause of death around the world.
Mm-hmm. So as the American lifestyle goes around the world, so does heart disease.
We're exporting our bad habits to the rest of the world, and they're quickly catching up with us.
So what are some of those big things that cause heart disease that if people are doing, they should stop, avoid, or whatever?
Yeah, the big things that we focus on with people that are at risk for heart disease or we know have heart disease are, #1, tobacco and smoking.
Now, why is that? What happens there with tobacco and smoking?
Yeah, nicotine and the effects of smoking pretty much just causes a promotion of the atherosclerosis, or the buildup of plaque that occurs in arteries. So this is a huge factor for disrupting the lining of the artery, and as a result of that, causing increased risk for plaque, which leads to heart disease, stroke, and vascular disease.
So would you say that's the single most important thing to stop if you're doing it?
That's the simplest thing you can do immediately that has big benefits. Just by stopping smoking within 1 year, you've reduced your risk for heart disease by 50%. And after 14 years of not smoking, you have the same risk as someone who's never smoked. So it pays off big time.
So stop right now, in other words, the message. #2 would be, you said something like diabetes, or maybe not #2, but it's a big one.
Diabetes is on the rise in America. It's related to diet, lack of exercise, and obesity. And diabetes also promotes the buildup of plaque or atherosclerosis in the heart. And it's a huge risk factor for heart disease. In fact, a person that has diabetes is at as high a risk of having a heart attack as someone who's already had a first heart attack.
So if you have diabetes, make sure and not just dismiss it. Treat it as quickly as possible.
It needs to be treated as aggressively as possible and focus on the things that put you at risk for diabetes.
So what's another one?
Obesity.
Okay, what's the issue there?
And obesity is hugely on the rise in America, largely due to our sedentary lifestyle and the fact that we eat in excess of calories, but the typical diet has more than 30% of those calories just coming from fat, and that leads to plaque.
Well, someone told me once that for every pound that you add, that's like 200 extra miles of things the heart has to work with, vessels and stuff. Is that true?
I don't know.
I don't know. Okay. Well, it's a lot more.
But
it's probably more.
The more you weigh, the more you have to carry that around every day, and that must be more work for the heart.
Okay. What about blood pressure? Is that an issue?
Hypertension is also a major risk factor in America. Hypertension has also been difficult to recognize and control. And the higher the blood pressure, the more a person is at risk for heart disease, but also for congestive heart failure.
Okay, so don't mess around with that. If you have that, take precautions to lower it, or do things that either natural-wise or medication-wise to get it down.
And hypertension is the one thing that you might not know that you have. It's called a silent killer, so it's important to get your blood pressure checked at least once a year.
Cholesterol.
And cholesterol is the other real big one, especially in America. The higher the cholesterol is, you have a much higher risk for heart disease. And we actually look at the breakdown of good cholesterol and bad cholesterol, as well as triglycerides. So each one of those plays an important role in the buildup of plaque.
So it's pretty easy now to know that a food that you're eating has high cholesterol, but what are just some basics to know for sure that it's got high cholesterol?
Yeah, this is something I tell patients every day. Animal products are higher in saturated fat. Saturated fat causes buildup of the LDL, or the bad fat, and a buildup of the triglycerides. And plant-based fats like nuts, almonds, pecans, avocado, olive oil, they're higher in the good fat, the HDL fat, that actually may lower your risk for heart disease. So a plant-based diet is the ideal diet. If someone's going to eat meat, it should be extremely on an occasional basis, and stay away from anything fried, anything full of saturated fat.
And I think you follow that yourself, don't you?
I do. I'm a vegetarian. Exercise, don't smoke, and try to keep my weight and blood pressure under control.
It's just like the things we have here, by the way, at the NEWSTART program, and help people with that. We're glad you joined us today. If you want more information on this, or these major risk factors and why or how to avoid them, or if you want more information, go to our website, newstart.com, and you can get more information there. And you can learn about our NEWSTART program even here at Weimar. Thank you so much, Dr. Schwartz, for being with us today. and
very welcome.
sharing what happens every day in your life. And thank you for being with us. And we hope that as a result of today's program, you can have a new start now.